Yeah, you have multiple stakeholders and multiple bosses in a sense, right?
Yeah.
You have to keep multiple people happy. Talk a little bit, Kenny, about how meeting all of these demands, in addition to meeting the demand of keeping family members updated, what is that doing to you and your staff?
Well, that's kind of where the morale's gone down. You've given everything you've had to this patient. The patient's doing well, they're getting better, but maybe something's not going quite right. And the communication from the patient to the family is a little bit skewed.
Yeah.
And so families coming in to say, I'm going to come save mom, and I'm going to tell them exactly this is what's going on, and I'm going to save the day. And then in reality, everything was being taken care of, and you have to get the family up to date of what's going on. But it's a huge morale downer.
Yeah.
Kind of justifying what you've done for your loved one when you've already known you've done most and everything required of you. The family just doesn't know, and they're not aware of that. And to so go
it's
through
a tough
when
position
you're
to be in, right?
Yeah, it really is.
When you're doing your best, but yet somebody assumes that your
worst.
intent isn't there, right?
Yeah.
Or assumes the worst. Now, instead of showing from a position of care, you're back on your heels and you feel like that you're having to defend yourself.
And it's usually at the end of the day when you've already been battling the day.
You're already
honestly,
tired.
it really
Yeah.
is 4, 5, 6 is when the families come in.
Yeah.
And so it really is at 7 o'clock at night when they're off work. Oh, I got to go find out what's going on and blah, blah, blah. And then anyway, so everybody's exhausted and you're trying to come up to a resolution of what's going on.
You got some sparks in the powder keg right there.
It's a perfect, there's a chance for a lot of failure there.